Thank you for choosing North Memorial Health for your joint replacement surgery. We're dedicated to providing you with the highest quality care. Our goal is to reduce your joint pain, restore your independence, and get you back to all the activities that you enjoy. My name is Chuck Lister. I'm the Joint Replacement Care Coordinator at North Memorial Health Hospital.
And I'm Rebecca Warenberg, Orthopedic Care Coordinator at Maple Grove Hospital. In this video, we'll go over important information that you need to know for surgery, including how to prepare for surgery, what to expect when you're in the hospital, and how to return to everyday life after surgery. We're here to help you get ready for the next step of the surgery process, so please watch this entire video. It should take you about 10 minutes. You'll want to find a time and location that will allow you to watch the entire video without interruption.
To start, let's talk about some important things to do about a month before your surgery. You might think that preparing for surgery a month in advance seems a little unnecessary, but the sooner you start doing these things, the less stress you'll feel and the more you can focus on your recovery. First, make an appointment with your primary care doctor for your preoperative history and physical. Next, arrange to have someone stay with you for at least the first 3 to 4 days after your surgery. You might need help preparing meals, bathing, and dressing. You'll also benefit from the help and motivation from family and friends. If you're having a total knee replacement, you should have physical therapy arranged prior to surgery. Contact your orthopedic surgeon's care coordinator to set this up. Total hip replacement customers generally do not require any additional therapy following surgery.
Beginning your joint replacement exercises as soon as possible can help speed up your recovery. You'll want to start doing pre-op exercises from the guidebook that your surgeon gave you. We would like you to do these exercises twice a day. Here are some things to keep in mind while you're exercising. It's important to strengthen your entire body, not just your leg. You'll rely on your arms a lot, so make sure to do arm and upper body exercises. It's okay to do exercises with both legs. You can do these exercises lying down or in a seated position. If certain exercises are too painful, it's okay to stop doing them.
You'll want your home set up for when you return from surgery. You can reduce the need for extra help if the house is clean, the laundry and yard work are done, there are clean linens on the bed, and you have single portion frozen meals ready to eat. Also, make it easy to get around after your surgery. Pick up throw rugs, and install night lights where you think you might need them. Let's talk about what needs to happen 2 weeks before your surgery. The main thing is, stop taking medications that can increase your risk of bleeding, such as aspirin, vitamin E, fish oil, and flaxseed capsules. If you're taking a prescription blood thinner, you'll need special instructions from your primary care physician for stopping. As your surgery draws closer, it's important to stop taking anti-inflammatory medications such as Motrin, ibuprofen, Advil, Aleve, and naproxen. These can also cause increased bleeding. You may continue taking Tylenol or acetaminophen for pain prior to surgery.
One to 3 days before surgery, a registered nurse will call you. They will tell you what time your surgery is scheduled for and what time you need to be at the hospital. Most customers will spend one night in the hospital. You'll want to pack 1 to 2 outfits of loose clothing and some well-fitting, comfortable shoes, like tennis shoes. Bring a list of your prescription medications. Don't forget your cell phone. If you use a CPAP or BiPAP machine, contact your joint replacement coordinator to find out what you need to bring to the hospital. Bathe with antimicrobial soap the night before and the morning of your surgery. Spend extra time thoroughly scrubbing your operative leg. It's very important that you don't eat or drink anything after midnight, even water.
The day you've been preparing for over the last month is finally here. It's surgery day. We want you to come to the hospital at least 90 minutes prior to your scheduled surgery time. It's important that you arrive on time. If you're late, your surgery could be delayed. Once you arrive at the front desk, we'll bring you to the pre-op area. During pre-op, you will have an IV line started, meet with your surgeon, sign consent forms, have the surgical site marked, and speak to the anesthesiologist. The surgery itself typically takes an hour to an hour and a half. After surgery, you'll go to the recovery room until you're stable enough to transfer to your hospital room. Your surgeon will meet with your family and friends to answer questions. Once you're transferred to your hospital room, staff will notify your family when you're settled and ready for visitors. You're in great care, with a team of experts that will support and guide you through the recovery process. After your surgery, you might see IV fluids, a surgical site drain, a urinary catheter, and equipment like foot pumps or calf sleeves to reduce your risk of getting a blood clot. Before you know it, it'll be the next morning. We'll help you get dressed and out of bed bright and early. Dizziness is common when getting up the first couple of times. Please do not try to get up alone. You'll have physical therapy the first morning after your surgery. Once you pass physical therapy and are medically cleared, you will be discharged from the hospital. If you need equipment such as a walker or a cane, this will be issued before you leave. You'll likely have a waterproof dressing covering your incision. This will typically stay in place for 1 week and can be removed at home. You can shower with this dressing in place.
Many customers ask about pain. While pain control will be a focus of care following surgery, you will not be pain-free. The goal will be to manage your pain. This will allow you to move around, participate in physical therapy, and have periods of rest. In addition to pain medication, we will use pain management strategies including ice, elevation, muscle relaxants, and relaxation techniques to help you to be as comfortable as possible. You will likely be on some form of blood thinner such as aspirin or a prescription blood thinner for 4 to 6 weeks. This is to reduce your risk of a blood clot following surgery. When you get home, it's important to continue the exercises. This will help reduce swelling and increase the strength and range of motion of your joint. Walking is just as important. Walk around your home at least 5 times per day. Trips to the bathroom and kitchen are not enough. Gradually increase the distance you walk. Walking helps build your strength and endurance, which will help you move easier and get back to doing the activities that you enjoy. After your surgery, leg swelling is common. In fact, your operative leg can continue to swell and bruise for the first 7 to 10 days. To reduce swelling, elevate your leg, use ice packs, and do ankle pumps. Let your surgeon know immediately if you have leg swelling that doesn't decrease after icing and elevating. Develop a sharp stabbing or cramping pain in your calf or thigh, or redness at the site of pain. These might be signs of deep vein thrombosis, or DVT, which can be life-threatening. If you have any questions regarding when you can drive or return to work, or if you need antibiotics prior to going to the dentist, be sure to ask your orthopedic surgeon.
My name is Beth. I had a total hip replacement at Maple Grove Hospital. My experience at Maple Grove Hospital was amazing. I knew I was in great hands, whether it was with the surgeon or with the team that was surrounding him during my surgery. They got me up that first night and started walking around, and I was able to move that hip with no problem whatsoever. It was amazing. I'm now back working out at the fitness center because I'm able to, since I had my surgery, and I'm able to do the bike, do the treadmill, do weight training. So it's been a really good thing. I know down the road, I probably will have a second hip replacement, and I wouldn't go anywhere else.
I think that wraps it up. Thank you for taking time to watch this video. We hope it's answered your questions and helped you feel confident and comfortable about your upcoming joint replacement surgery. If you have more questions, please call us. Or take a look at the booklet from your orthopedic surgeon's office. You'll find many common questions answered there.